Today installation has started and we are very happy to see the tents going up. Today, like any other public hospital, Mapen Hospital does have its challenges, and we are seeing consistent increase of COVID positive patients. Today our number is 39 positive and we have 25 suspected cases. Our bed occupancy at present is 188. We continue to monitor our isolation ward at this time, which is a 26 bed space. We are now full, but we continue to ensure that we keep our COVID patients in areas so to avoid or minimize infection control. Our isolation side rooms, we now occupy those areas and we have selected a cubicle on the ward area where we have those patients in one area. Today installation has started and we are very happy to see the tents going up. The tent that we had received, it's a 40 bed tent, and with that number we are anticipating that we will be having adequate space to accommodate our patients. The expected completion time for the installation of the tent, we are looking at Friday, September 10th. That's the time in discussion with the Jamaica Defense Force. So far, work is going steadily. The lavatory facility is also in process of construction to begin. Excavation should take place starting tomorrow. And we are looking at 4 weeks for the construction, final completion of the bathroom facilities. And if you might ask me within that 4 week, what is our intention? Once we see the increase of patients coming in with COVID symptoms and those positive. We are looking at a possibility of trying to get portable bathrooms and toilet facility so that if the need arises before the 4 weeks, then we can start service within that area. So far, our oxygen is good. We have adequate 6.91 cylinders. Our liquid is also going well. When I look at the data based on our usage, I see where we have approximately a week supply. And we usually send in our order to IGL within a certain level, reorder level, and we anticipate that we will be getting liquid. We do have high demand because comes times the patients who present with severe respiratory illnesses, some of those patients, they have to be ventilated, and also the usage of the HFNC machine, which actually utilizes 60 liters per minute. But what we do, we continue to do reading every 2 hours so that we are abreast of what is happening and able to see the flow of the liquid, how fast that is going. Because in looking at our reading, between yesterday to today, we have utilized up 753, where we see an increase of 50 liters, an increase, and that would be because of our patient on the HFNC machine. But as I said, we continue to monitor. Every 2 hours, our report is given from the maintenance operations department. And we are in close communication with IGL because oxygen is life. As far as I know, all categories of staff in our facility, they have been very receptive. I am unable to give you a number or a percentage, but for the most part, our staff at the initial stage when the AstraZeneca came, staff came out and they have been taking their vaccines. Also, on the Operation Blitz, staff turned up, they participated, and we have seen where a large number of our staff here at Mapen Hospital are in support of it and have taken their vaccines. We continue also to encourage, because there might be some that have not taken. I just want to take this opportunity to appeal to our Jamaican people. This is not a fairy tale. We need to understand the importance of taking the vaccine, because once you take the vaccine, you are in a better position if you should come in contact with the virus as against if you have never taken the vaccine. So I encourage you all to be vaccinated and also continue to follow protocols, because so many places you go and you see gathering and persons not wearing their masks. You must wear your mask. Social distancing is very important, and sanitizing, and stay home if you don't have to go on the road, because COVID-19 pandemic, it is real. We have been seeing numerous deaths, and I am sure all of us wants to live